Welcome back. This is Dr. Emir. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser known approaches and hidden strategies to help the people with critical illness. You can subscribe if you want to learn the latest news and healthy solutions about your health.
Begin with this. Do not think of anxiety only as thoughts moving too fast. Think of it as an alarm system involving the brain, the gut, the immune system, the stress hormones, the sleep-wake rhythm, and even the microbes living inside the digestive tract. Now ask yourself, why does fear sometimes feel like nausea? Why does stress tighten the stomach before it becomes a thought? Why do some people feel anxiety in the chest, the throat, the bowels, or the skin before they can even explain what they are afraid of? Look at that carefully. Anxiety is not just in the mind, it is often a whole body state. The brain reads signals from the body, and the body reads signals from the brain. This two-way communication is called the gut-brain axis, and it includes the vagus nerve, stress hormone pathways, immune signaling, microbial metabolites, and neurotransmitter-related chemistry. That is why the idea of probiotics is not simply about digestion. It is about whether supporting the gut environment can gently influence the biological background in which anxiety develops. So listen with precision. Probiotics are not a replacement for psychotherapy, medication, emergency care, or proper medical diagnosis. Keep that boundary clear. Cognitive behavioral therapy, exposure-based therapy, and medication remain established treatments for anxiety disorders. Use probiotics, when appropriate, as a supportive tool, not as a magic cure and not as an excuse to avoid professional care. But do not dismiss them too quickly either. Why? Because the digestive tract is not a passive tube, it is an information system. It samples food, communicates with immune cells, produces signaling molecules, hosts trillions of organisms, and sends continuous updates to the nervous system. If that internal environment becomes more stable, the brain may receive fewer distress signals from the body, and when the body becomes less noisy, the mind often has less to fight. Let us ask the first major question. Why could probiotics help with anxiety? Start with the stress response. When the brain perceives threat, the hypothalamic pituitary adrenal axis, often called the HPA axis, activates, cortisol rises, heart rate shifts, digestion changes, sleep becomes lighter, attention narrows. Now reverse the direction, signals from the gut can also influence that same stress system. If the gut is inflamed, irritated, or metabolically imbalanced, the nervous system may receive a steady stream of "something is wrong" messages. That does not create every anxiety disorder, but it can raise the baseline tension. Now ask, how could a probiotic change that baseline? First, by changing microbial activity. Some probiotic strains can support the production of short-chain fatty acids, compounds that help maintain the gut barrier and influence immune tone. A stronger gut barrier matters because when the intestinal lining is irritated or more permeable, immune signaling can become more active, and when inflammatory signaling rises, the brain does not ignore it. It can translate that immune noise into fatigue, tension, low mood, irritability, and anxious arousal. Second, probiotics may influence neurotransmitter-related pathways. Do not oversimplify this. Most serotonin in the body is associated with the gut, but that does not mean eating a probiotic directly pours serotonin into the brain. Be more exact. Gut microbes can influence tryptophan metabolism, GABA-related signaling, and other chemical pathways that affect the nervous system indirectly. Some lactobacillus and bifidobacterium strains have been studied for their relationship to GABA, a calming inhibitory neurotransmitter system involved in anxiety regulation. Third, consider the vagus nerve. Ask, how does the gut speak so quickly to the brain? One route is neural. The vagus nerve carries information from internal organs to the brainstem. It helps regulate heart rate, digestion, inflammation, and emotional state. When the gut environment changes, vagal signaling may also change. This is one reason researchers became interested in psychobiotics, a term used for microbes that may influence mental health through the gut-brain axis. Now move from mechanism to evidence. Do not accept claims just because they sound elegant. Demand clinical data. Ask, what have human studies actually shown? The answer is balanced. Earlier meta-analyses found that animal studies looked promising, but human results were mixed, and some reviews did not find a clear anxiety benefit compared with placebo. That matters. Say it plainly, the science does not support the idea that any random probiotic will reliably reduce anxiety for everyone, but the story did not stop there. Later reviews and meta-analyses of randomized controlled trials have reported small to moderate improvements in anxiety symptoms in some groups, especially when looking at specific strains, specific populations, and multi-week interventions. Newer reviews also emphasize heterogeneity. Different strains, doses, durations, populations, and anxiety scales can produce different results. So use the key phrase, strain matters. Do not say, I am taking probiotics. Say, which strain, at what dose, for how long, and for what outcome. Now look at some clinical clues. A well-known combination. Lactobacillus helveticus R0052 and Bifidobacterium longum R0175 has been studied in human volunteers. In a randomized, placebo-controlled trial, this combination was associated with improvements in psychological distress measures over about 30 days, including scores related to anxiety and depression, and it was also linked with changes in stress-related markers such as urinary cortisol. Do not overstate it. Say this. It suggests a biological signal worth respecting, not a guaranteed treatment for diagnosed anxiety disorders. Another line of evidence comes from brain imaging. In a randomized controlled study, healthy women consumed a fermented milk product with probiotic strains for 4 weeks. Functional MRI showed altered activity in brain regions involved in emotion and sensation processing. Pause there. The most important point is not that yogurt treats anxiety. The point is more precise. Changing the gut microbial environment was associated with measurable changes in emotional brain processing. That is a serious idea. There is also research involving Bifidobacterium longum NCC3001 in people with irritable bowel syndrome. IBS is important because gut symptoms and anxiety often travel together. In a pilot randomized study, this strain was associated with reduced depression scores and altered brain activity related to emotional processing, though anxiety results have been less consistent. What should you learn from that? Learn that the gut-brain connection may be strongest in people whose anxiety is tied to digestive symptoms, body vigilance, bloating, pain, or stress-sensitive bowel patterns. Now ask the practical question. How should someone use this information wisely? First, screen for safety. Do this before enthusiasm takes over. If someone is severely ill, immunocompromised, has a central venous catheter, has had major recent surgery, is a premature infant, or has complex medical conditions, probiotics require medical supervision. For generally healthy people, probiotics often have a good safety record, but long-term safety data are not perfect, and some populations face higher risk. Second, choose the product intelligently. Do not buy based only on the biggest number of CFUs. Look for the full name, genus, species, and strain. For example, Lactobacillus helveticus R0052 is more specific than Lactobacillus. Bifidobacterium longum R0175 is more specific than Bifidobacterium. The strain is like the exact address. Without it, you do not really know what organism you are using. Third, give it enough time, but not endless time. Try a structured window, usually 4 to 8 weeks, unless a clinician advises differently. Track symptoms weekly. Use a simple anxiety scale, or write down sleep quality, morning tension, bowel symptoms, caffeine intake, panic episodes, and emotional reactivity. Do not rely only on memory. Anxiety distorts memory. Measurement protects you from guessing. Fourth, support the microbes you already have. Ask, how can a probiotic help if the diet keeps starving the gut ecosystem? Add prebiotic fibers gradually. Oats, legumes, lentils, onions, garlic, asparagus, slightly green bananas, chia seeds, and diverse plants. Move slowly if bloating is a problem. Add fermented foods if tolerated. Yogurt with live cultures, kefir, kimchi, sauerkraut, miso, or tempeh. Keep the plan simple, one change at a time. Observe the response. Fifth, combine it with anxiety fundamentals. Protect sleep. Reduce excess caffeine. Practice slow breathing. Move the body daily. Stay connected to people. Use therapy when anxiety controls behavior. Why combine these? Because probiotics may lower the background biological tension, but therapy teaches the brain what to do when fear appears. Nutrition can support the terrain. Treatment changes the pattern. Now let us be honest about expectations. If someone has severe panic disorder, obsessive fear loops, trauma symptoms, suicidal thoughts, or anxiety that prevents work, school, parenting, or basic functioning, tell them, seek professional help. Do not wait for a capsule to solve a clinical condition. But if someone has mild to moderate anxious tension, stress-sensitive digestion, low resilience during pressure, or a body that seems constantly on alert, probiotics may be a thoughtful adjunct. Ask again, why might this work best for some people and not others? Because anxiety is not one single biological state. One person's anxiety is driven by trauma memory, another person's by panic sensitivity, another person's by thyroid disease, stimulant use, poor sleep, alcohol withdrawal, chronic inflammation, or gut dysfunction. So do not treat probiotics as a universal answer. Treat them as one targeted lever in a larger system. And here is the deeper lesson. The body may be whispering before the mind starts shouting. The gut may tighten before the thought becomes clear. The immune system may stir before the emotion gets a name. The sleep cycle may break before the panic arrives. So teach people to listen earlier. Tell them, notice your stomach, your breath, your sleep, your bowel rhythm, your cravings, your caffeine pattern, your stress timing. These are not random details, they are data. So what is the final message? Use probiotics with intelligence, not hype. Respect the gut-brain axis, but do not exaggerate it. Choose studied strains when possible. Track your response. Combine probiotics with fiber-rich food, sleep care, movement, breathing, and evidence-based mental health treatment. Ask better questions. Why is my body on alert? How is my gut behaving when my anxiety rises? How can I lower the biological background noise while also training my mind to respond differently? The benefit of probiotics for anxiety is not that they erase fear. The benefit is that in the right person, with the right strain, for the right duration, they may help calm some of the internal signals that keep the nervous system tense. That is the practical power here. Not a miracle, but a biologically plausible, increasingly studied, low-burden support that may make the whole system easier to regulate. Take this seriously, but take it wisely. Speak with a clinician when needed. Do not abandon proven care. Build a plan that respects both the mind and the body. Thank you for being here with me today. Take care of yourself, take care of each other, and let's keep learning like a family. One topic, one step, one healthier life at a time. See you in the next episode.